Good afternoon, and thank you for joining us. Thank you to Vice Chair Patricia Cusack, who is here with me today. And thank you to the mayors of our municipalities, City of Wilmington, Mayor Bill Saffo, Carolina Beach, Mayor Leanne Pierce, Curie Beach, Mayor Craig Blazinski, and Wrightsville Beach, Mayor Daryl Mills, for joining me today for this coordinated effort to extend our local stay-at-home measures to help slow the spread of COVID-19 in our community and prevent our healthcare system from becoming overburdened. Yesterday, we learned of our community's first confirmed death from COVID-19. This news was heartbreaking to hear, and my deepest sympathy goes to their family and friends during this difficult time. The person was in their 40s, and public health is not aware of any underlying health conditions that made this patient at higher risk for severe complications from COVID-19. So this is a stark reminder of the seriousness of COVID-19, and it makes what we are doing here today and the actions of every single person in our community even more important. It reinforces more than ever why we must do everything we can to prevent further spread of this virus in New Hanover County. Almost a month ago, on March the 20th, I declared a state of emergency for New Hanover County, and then over the weeks that followed, we implemented additional countywide restrictions. A lot has changed for our community over the past month, and I appreciate so many of you listening to our public health experts, following the orders in place, and doing your part to help limit the spread of COVID-19 in our community. I know it hasn't been easy, and I know many of you are concerned about what the future might hold for your health, your employment, and your livelihoods. I hope that in the coming weeks we will know more, we will have reached our local peak for this virus, and we can begin to reopen and recover. Today, though, is not the day when our restrictions can be lifted. We have to continue to be diligent in everything we do. We have to make sure we slow this virus down, which we have seen has been working in our community and in other areas through social distancing measures. We have to remain on this course to help every single person in our community safe. So the restrictions that were set to expire at 5 p.m. will be extended until Wednesday, April the 29th at 5 p.m. in keeping with the timeline of the governor's stay-at-home order. But we will be lifting 2 restrictions for the community to be able to get outside a little more and enjoy time with your family. Public and private marinas, boat ramps, tennis and pickle courts can now be reopened. The public boat ramps in this county will be accessible beginning at 5 p.m. today. I know this is welcome news to many of you, but I want to remind you, if you go to put your boat in the water or you walk into a tennis court and there's others around, please keep your distance. Stay 6 feet away from others and do not congregate in groups. Please don't tie up your boat with anyone. Please don't anchor and create a crowd on an island. Please just stay with your family on your boat and do not congregate with others. As a reminder, all public access points to beaches in New Hanover County are still closed. I want to thank our law enforcement for everything they have done these past few weeks to help educate our community and enforce rules when needed. They will continue to be vital in the weeks to come, and they'll be actively patrolling our waterways. They are there to keep our community safe and to ensure that your actions reflect the social distancing orders in place. I appreciate all that they are doing. We have also enhanced the countywide order to include an expanded list of essential services that provide goods needed for health, sustenance, shelter, safety, security, communication, mobility, clothing, and hygiene. The stores providing these essential goods will not be asked to close off sections of their stores that are deemed non-essential. Dressing rooms should remain closed off, though, and all essential retail stores must abide by the governor's new order beginning at 5 p.m. that limits the number of people that can be in a store at one time. But I want to remind everyone, ordering something online and picking up on curbside, often the same day, is the best way to shop because you avoid any potential germs inside a store. And all retail stores are able to continue curbside and delivery options. In the updated order, we also included additional guidance for auto and boat dealerships to allow them to open as long as they abide by 11-point safety tests will help ensure that the sales exchange can be made safe as possible. We will continue to evaluate our updated stay-at-home order each week and revise the restrictions as needed as a coordinated approach for all of New Hanover County. We hope to be able to lift or loosen other restrictions in the coming weeks, and those decisions will be informed by our public health and hospital experts who have the greatest insight into this crisis and can help guide those decisions in a thoughtful, safe way. We know that none of this is easy, but stopping measures now could result in a jump of severe cases in our community and then potentially overrun our health system. Overwhelming our health hospital has consequences outside of COVID-19 because other medical needs don't stop because there is a virus. Heart attacks, broken bones, and car crashes still happen. So if the hospital is overwhelmed because of a mass transmission of COVID-19, it could affect the people who need care for other reasons. In partnership with the hospital, we are sharing today that currently there are 13 patients in New Hanover Regional Medical Center who have COVID-19. And while that number may seem small, the people who are in the hospital have severe symptoms and some are on ventilators. But overall, it is clear that these protective measures are working. New Hanover Regional Medical Center serves a 7-county region, not just our local residents. So the goal is to keep this patient number small and not to overwhelm our health system. The hospital has been and continues to take proactive measures to ensure these patients are isolated and our healthcare workers remain safe as possible. So continuing our countywide measures to the end of April will help to save lives, protect our healthcare workers. It will help make the impact of this virus more manageable so that everyone can still get the care they need, whether it's COVID-19 or something else. Staying at home and changing the way we do things is difficult, so our hope is that you are able to find the support and outlet you need to continue this fight. Physical distance from others doesn't mean distance from nature, so getting outside while practicing social distancing can help lift your spirits while moving your body. And more opportunities for that are available with the modifications of our local order today. There are several other emotional support resources available to help you cope with what has been a stressful shift in the way we live our everyday lives. Specifically, the Hope for North Carolina helpline can be reached at 1-855-587-3463, and it can help connect you with mental health and resilience supports. It is available 24 hours a day, 7 days a week, and when you call, you will be able to speak to a live person. You can also help our community through this crisis by visiting sharecapefear.org to learn about ways to support organizations like the New Hanover County Disaster Coalition, who are helping those in need because of job loss of child care, and other challenges. You can also support healthcare workers by visiting the hospital's foundation page at nhrmc.org. Our website, health.nhc.gov, has more of this information, and you can follow New Hanover County on social media for continuous updates and important resources. As a reminder, our public health nurses are still operating a coronavirus call center Monday through Friday from 8 a.m. till 5 p.m. If you call on the weekends, a nurse will return your call within 24 hours. That number is 910-798-6800, and our nurses are available to help you assess your personal risk of COVID-19 and point you to some of the resources I just mentioned. New Hanover County is working every single day to protect everyone in our community. We are working with our community partners to help protect those who are homeless. We are working with long-term care facilities to ensure that they have the best practices in place and the right protective equipment to help prevent a virus outbreak. We're working with the hospital to ensure they have enough protective equipment for their staff also, and our community has been incredibly generous with this effort, donating over more than 30,000 pieces of protective equipment. Our team is actively working to help keep you safe and healthy, and that is our priority. And we also know that the need to reopen businesses and access services and really just get back to life is something we are all striving for. The county is already thinking toward the future and planning for the recovery that will be certainly needed for our community. We're actively working with our economic development and municipal partners, and planning is underway on how we can reopen our local economy based on state policy actions and the direct needs of our businesses and our citizens. We have strong partnerships and incredible community backing that will put us in a position to collaborate and help our community recover. In the weeks to come, we hope that social distancing can transition to smarter overall public health practices, and businesses that have closed or reduced operations as a result of the pandemic can return to their pre-crisis status, with workers returning and storefronts opening. Please know we are working toward that, and New Hanover County is actively planning for recovery. In the meantime, I ask you to continue to have patience as we navigate through this uncertain time. Please continue to listen to public health's guidance and the information from our experts. What we do today will have an impact on how our community fares through this pandemic. Please continue to support one another, and please continue to stay home. If you have to go out in public, remain 6 feet away from others, wear a mask to keep any potential germs to yourself, wash your hands well and often, and do not gather in groups. It is important that we continue to work together to prevent the spread of COVID-19 so that we can protect our most vulnerable and avoid overwhelming our healthcare system. And now I will turn it over to our local mayor to say a few words, followed by Lisa Brown, our public health expert. First, Wilmington Mayor Bill Saffo.
Thank you, Madam Chair, and I also just like to echo the work and the hard work that's gone into this with the local mayors here in our county government and city governments. This is obviously a very serious time in our community, and we have done well, Wilmington. And I just want to say thank you to the citizens that are abiding by the rules and the regulations. They are paying dividends for each and every one of us. And I just want to say thank you, thank you, thank you, because without you, that curve would have gone straight up, and we're tapping it down, and that's what we need. And we've got a little ways more to go with this. I want to make sure that everybody just understands that this is not a sprint, this is a marathon, and we're going to get through it. But as we find ways to lift some of these regulations, we will, and we are talking amongst ourselves to determine how those regulations will be lifted and what will be implemented when we do lift them. So again, want to say thank you to all of the local governments and everybody that's working together and very hard to get through this. So thank you very much.
Hi, thank you, Julia and county commissioners, for having these meetings we're having. And I want to reassure our citizens that we are meeting very frequently, almost daily, conference calls with our county commissioners and our county mayors and staff to discuss what is the best way to reopen and recover from this. And I just want to thank my citizens. You guys are doing a great job. You're following the rules. I'll ask you to continue to do that. Do your part, continue to social distance, follow the rules, and we'll get through this a lot faster. So thank you so much.
Craig Blazinski, Curie Beach. Thank you, commissioners and mayors. Even one death is a tragedy and hard to fathom. But our numbers are relatively low. And with those relatively low numbers, we actually have to thank the doctors, the nurses, the police department, the firemen, and all those people who put their health on line for us. We also need to thank the businessmen who put their economic future on hold for us, as well as the furloughed workers. I would tell you, you're all soldiers in this fight, and we thank you for what you've done and expect you to continue to do it. Thank you very much.
I want to thank the residents of Riceville Beach for their cooperation, their understanding, and their abiding by the rules. I know these are tough. Everyone's anxious to get out on the beach. We ask that you hold the course steady for a little while longer. We are constantly monitoring and talking about what we can do and what's the safest course of action to take. Please consider your neighbors and your friends as we take these difficult times and work through them together, hopefully. I ask for your patience a little longer. Thank you.
Good afternoon. I'm Lisa Brown, and I'm the Public Health Preparedness Coordinator for New Hanover County. Since February, myself and a team of other public servants from public health, emergency management, and other departments have been solely focused on preparing for and responding to COVID-19. And while we plan for things like pandemics all the time as part of our all hazards approach to preparation, each event is different, and we're learning more about COVID-19 every day. I'd like to thank Chair Olson Bozeman, and the county, city, and beach town leadership for their support of public health as we respond to COVID-19 and for continuing these important mitigation measures to reduce further spread of the virus. Now, there have been 60 cases of lab-confirmed COVID-19 in New Hanover County. Of those, 27 people are still ill and experiencing symptoms, and thankfully 32 we can report have recovered. Sadly, as the chair mentioned, we've now confirmed one death from COVID-19 in our community. It's important to understand that the number of lab-confirmed cases does not represent all possible cases in our community. Now, due to the testing criteria and the CDC's recommendation that those with mild symptoms don't get tested and should stay at home and recover. So our numbers are primarily reflective of people that are thought to be at risk for more serious illness or those that are experiencing very severe symptoms. This leads to our understanding that there are likely many more cases in our community that are unknown because we don't have lab-confirmed tests that goes along with that. And I can share with you, in the state of North Carolina, there are currently reflected to be 4,816 confirmed cases of COVID-19. And approximately 8.3% of those are either hospitalized or have died from the virus. I share that to impress that this is still a serious matter. And decisive action will prevent the virus from having an even bigger impact in our community. So again, I thank our elected officials for taking this matter so seriously. And I want to remind our community about the guidance from the North Carolina Department of Health and Senior Services that people with mild symptoms consistent with COVID-19 don't necessarily get tested and stay home to recover. And mild symptoms would include things like a fever and a cough. And I understand that it's very unsettling to be sick and to not know if you have the virus for sure. But going to the doctor might actually put you or others more at risk. And I share that none of us are immune to this. And in fact, in my own family, I have extended family out of the area that have had this experience. But if you are experiencing symptoms and you are in that higher risk category, meaning you're over 65, or you know you have an underlying health condition like chronic lung disease, even asthma, or a compromised immune system, heart disease, obesity, or are pregnant, please go ahead and contact your healthcare provider or walk-in clinic to discuss testing. And if you don't have a primary care provider or you lack insurance, you can call our coronavirus call center at 910-798-6800. A public health nurse will be able to connect you with a clinic, or you could just speak to our nursing team to discuss testing further. So what we still know is that 80% of the COVID-19 cases appear to be mild, but that means that there's another 20% or so that could be more severe. So if you experience serious symptoms, and these would include shortness of breath, difficulty breathing, chest discomfort, altered thinking, or bluish discoloration of the skin, we would ask that you seek treatment immediately. And we want our community to be safe, and we want you to be healthy, so please continue to heed the advice. Seek medical care if you need it, but otherwise, please stay home, take care of yourself, and recover. And I'm going to echo what our chair said, because I don't think we can say it enough. Please stay home. If you must venture out in public, remain 6 feet away from others. Wear a mask to keep potential germs to yourself and protect others. Wash your hands well and often, and do not gather in groups. So our actions today will impact our nurses, our doctors, our emergency responders, our essential workers, the elderly, our families, our entire community in the weeks that will follow. So please do your part, follow the stay-at-home orders that are currently in place, and help us protect everyone around us. Thank you.
Are there any questions?
All participants have been unmuted.
We'll have a few questions from the media. First is Emily Featherstone with WECT.
Hi, yes. I was hoping you could reiterate what led the county and mayors to determine that it was okay to loosen some of these restrictions, what the motivation was, and also if you have any concern from the medical community that you might have to clamp back down if there's a new spike in cases.
Well, I think that we saw a lot with retail shopping, as public health had told us to begin with. If you don't do it regionally, then it's not going to do any good. So if you have got people that are going shopping at Walmart and Leland, it's not doing any good. So we felt it was best just to go under the governor's guidelines so that we have consistency throughout the state and throughout the region. And we hope that it's not going to get worse, but if it got worse, then of course we put whatever measures we needed to put in place. But we're hoping that we are coming out of it.
The next question will come from Kylie Jones at WWAY.
Yes, hi. Commissioner Olsen-Bozeman. There's been some discord amongst the board in terms of where commissioners stand on these restrictions with their personal opinions. Commissioner White has spoken out about his stance on these restrictions, opposing a majority of them, and he stated that the county's messages were fear-mongering. Is there a response to that, or just in general a response to anybody who may oppose these restrictions?
Well, we're following what public health says and what the professionals are saying at the hospital, and we're just trying to keep people safe. There has been some discourse, but as I spoke with the county manager earlier, I don't go forward with any of these decisions without, consultation with the mayors and all of the commissioners. It has not a unanimous vote, but there is a majority of the commissioners that feel like what we're doing is best for the community. Everybody wants business to go back to normal. I mean, I want it to go back to normal, but we have health concerns and we have a pandemic and we need to do what's safe. And we are trying to stay in line with what the governor's doing to have the consistency that we need. And that's why we meet with the mayors on a regular basis. Sometimes we disagree too, but we always come out with a consistent message. And that's what's important, is that we all stick together through this.
Thank you.
All right. Thank you all for being here.